This is a video lecture regarding glycogen storage disorders. Guys, glycogen storage disorders are classified based on their enzyme deficiency, right? So, we'll be talking around 7 glycogen storage disorders. Fine. So, let's start. The first is the glycogen storage disease 0. So, guys, 0 means what? The name of the enzyme which is deficient here is glycogen synthase. So, guys, if there is no glycogen synthase, what will happen? There will be nil amount of glycogen in the liver. It is not formed, right? So, what will happen to the investigation part? If you see, there will be hyperglycemia after consumption of food, right? Because liver is unable to clear the blood right? Because it is unable to remove the glucose, right, and store as glycogen. So, there will be more amount of glucose in the blood for long time, right? Insulin will be helping, but the liver is not helping here. Fine. So, how will you identify the type 0 glycogen storage disease? By two things. Postprandial means after the food, postprandial hyperglycemia and nil amount of glycogen in the liver, isn't it? Now, also you can identify these patients by fasting hypoglycemia, right? Because there is no glycogen in the liver. So, whenever they fast, even for 1 hour, 2 hours, 3 hours, not 1 hour, but 2 or 3 hours, there will be no blood sugar, right, released from liver. So, there will be hypoglycemia. So, this line can be important that patient's liver had nil amount of glycogen present. So, this is the unique line that you should remember, and postprandial hyperglycemia also. So, guys, that is type 0 glycogen storage disease. Now, we have the type 1 glycogen storage disease. So, guys, type 1 glycogen storage disease is called as von Gierke's disease. Now, guys, von Gierke's disease is caused by the deficient enzyme, that is glucose 6 phosphatase. Glucose 6 phosphatase is the enzyme which is absent in muscles already. Only liver has glucose 6 phosphatase. So, muscles are not affected in this disease, right? So, muscles are not affected. So, if you see any question where the patient is presenting with muscle weakness, you can say that this is not the case of von Gierke's disease. Why? Because von Gierke's disease never affects muscles, because the name of the enzyme which is deficient is of the liver, that is glucose 6 phosphatase. So, what happens next? If the glucose 6 phosphatase is missing, so guys, which two pathways will be affected? As I told you, glucose 6 phosphatase is the common enzyme of two pathways. The last step of gluconeogenesis and the last step of glycogenolysis. As we know that these are the only two pathways which maintains our blood sugar. So, what will happen to this patient? Severe hypoglycemia in the fasting. So, guys, that is why the treatment of this patient is nothing but to avoid any kind of fasting. Feed this baby every 2 to 3 hours. That is the only treatment available, right? Even in the night, the baby has to be fed. Fine. Because the glucose 6 phosphatase is missing, there is increase in the amount of glucose 6 phosphate. So, this is our second point. So, first was the fasting hypoglycemia because glucose 6 phosphatase is missing. Now, the second is that because the glucose 6 phosphatase is missing, there will be high amount of what? Glucose 6 phosphate. So, guys, what happens to this glucose 6 phosphate? The three fates are possible for this glucose 6 phosphate. Number one, this glucose 6 phosphate will be used in the HMP shunt pathway, and guys, this will result in the production of the ribose sugar, that is ribose 5 phosphate, and this will enter or activate the purine synthetic pathway. This will produce unnecessary purine nucleotides which will be degraded to uric acid. So, guys, what happens is hyperuricemia, okay, because of excess G6P. Now, what happens next is hepatomegaly, that is massive, right? Massive hepatomegaly. So most of the time these patient presents with protuberant abdomen, the big abdomen with the thin extremities, right? And sometimes we call them doll-like faces, right? Doll-like faces, big abdomen, large abdomen and chubby face, and there is a thin extremities. So that is how this baby presents. So remember this line, doll, D-O-L-L, doll-like faces, okay, similar to the doll. So guys, one is hyperuricemia, second is hepatomegaly. So why there is hepatomegaly? Because there is excess amount of G6P. So guys, this G6P activates the rate limiting enzyme of glycogen synthesis, and that is glycogen synthase. Okay. So guys, glycogen synthase will unnecessarily keep on making more and more and more glycogen. So this will keep on stored in liver, and liver keep on enlarging, right? So that is hepatomegaly, enlarged liver. Now the third is lactic acidosis. Lactic acidemia may also happen because the G6P may enter or flood the pathway of glycolysis, right? And which may generate lactate. So guys, these are the few features that you must remember. Again, summarizing: hypoglycemia, hepatomegaly and hyperuricemia, all starting with the H, right? And maybe lactic acidosis. So guys, this is von Gierke's disease. Now guys, there is a test that is called as Glucagon challenge test. Now Glucagon challenge test simply means that if you give glucagon to someone, to a healthy person, what will happen? The glucagon will degrade the glycogen. How? By activating the rate limiting phosphorylase. So suppose you called a patient, right, that you are suspecting of some glycogen storage disease, and you gave the injection of glucagon. So guys, what happens after giving glucagon? In a normal person, there will be increase in the blood sugar. So that is called as positive glucagon challenge test, right? Because glucagon activates the rate limiting glycogen phosphorylase, which breaks the glycogen, generates glucose, which increase the blood sugar levels, like that. Now, in this patient, because the glucose 6 phosphatase is missing, so obviously there will be no glycogenolysis, right? The last step is missing, na? So if you give glucagon, there will be no rise in blood sugar. Am I correct? So that's the point to remember. Negative glucagon challenge test in the patients of von Gierke's disease, always. Now coming to our next topic, GSD2 or the glycogen storage disease type 2. Guys, type 2 is also called as Pompe's disease. Pompe's disease is caused by the deficiency of lysosomal, highlight it, acid maltase. Guys, lysosomal acid maltase is an enzyme which is also called as alpha-1,4 glucosidase. So what is the purpose of this enzyme? Guys, this enzyme prevents the accumulation of excess glycogen in the liver, right, by degrading it into the in the lysosomes. So whenever there is extra glycogen is made in the cytoplasm, this will appear in the lysosomes later on, and that will be degraded to glucose by this enzyme, right? So this is the normal activity of this enzyme, that is preventing unnecessary accumulation of glycogen in a healthy liver. So if this enzyme is missing, what will happen? So guys, lysosome will keep on accumulating the glycogen because they are unable to degrade it now, and this will keep on increasing the size of lysosomes, right? So guys, presence of glycogen in lysosomes is diagnostic of Pompe's disease. No other glycogen storage disease has glycogen present inside the lysosomes. So I can say that type 2 Pompe's is the only glycogen storage disease which is also called as lysosomal storage disease, LSD. Right guys, LSDs or lysosomal storage disease we will discuss in some other topics, like there may be Gaucher's disease, then there may be Sandoff's disease or Tay-Sachs disease, etc. There are a lot of other diseases we'll discuss in lipids. So understood, this is the only LSD which is the GSD. Okay. Now what happens to this patient? So guys, this patient presents with hepatomegaly, hypotonia, that is weak muscles. And guys, the third very important point to remember is cardiomegaly. So very unique finding apart from glycogen in lysosomes is heart failure because of cardiomegaly. You know guys, there is accumulation of glycogen in the heart tissues and this increases the size of the heart, that is cardiomegaly, right, and this may lead to heart failure. So remember these points about Pompe's disease. Now guys, Pompe's disease, can be treated by a term that is called as enzyme replacement therapy. These are the injectable enzyme as a drugs which are available in the market. Not for every disease, but for this disease in the GSD, only this disease in the GSD can be treated by enzyme replacement therapy, right? ERT. Okay. So that is the Pompe's disease. Guys, just to remember like Pompe's affects the pump, right? Pump is our heart, so cardiomegaly is there, heart failure is there. Pompe's affects the pump. Fine. And guys, heart has 4 chambers, right? And so the name of enzyme which is acid maltase is alpha 1,4 glucosidase, 4, right? There is 4 is there. Like alpha 1,6 I will tell you in debranching enzyme. So alpha 1,4 glucosidase, just to remember, right? You can make your own mnemonics also. Now next is number 3. Type 3 GSD is Cori's disease, C-O-R-I, or the Forbe's disease. That's the other name. Cori's disease, there is an absence of the enzyme that is called as debranching enzyme. Right guys, we can make a mnemonic like this, ABCD of GSD. AB for A for Anderson and branching enzyme. C for Cori's and debranching enzyme. So ABCD of GSDs. So guys, in the Cori's disease, there is a deficient debranching enzyme. Now guys, what is the function of debranching enzyme? To remove the last 4 glucose residues, right? What is the other name of debranching enzyme I told you? Alpha 1,6 glucosidase, isn't it? So guys, alpha 1,6 glucosidase is the name of enzyme that you will remember, or debranching you will remember. So what will happen to this patient? There is accumulation of glycogen in the liver which is of short branches, right, or limit dextrin. So guys, I can call this disease as limit dextrinosis, okay, and the appearance of the glycogen is glycogen accumulated which is having short branches, right? So that is our disease that is called as Cori's disease. Fine. Guys, in the Cori's disease, if you do the glucagon challenge test, it will be negative in the fasting state. Now suppose you have a patient of Cori's disease, you call this patient after 12 hours of fasting, right? So during the night when the patient was fasting, all the glycogen was cut by phosphorylase, right? And what is left is only 4 glucose because debranching is missing, na? So in the morning, the patient's liver will have only 4 residue glycogen called as limit dextrin. Rest is used during the night to maintain blood sugar by the phosphorylase. Now in the morning, you give the glucagon injection. What will happen? Glucagon only activates phosphorylase, not the debranching. And guys, phosphorylase has nothing to cut because phosphorylase doesn't cut the last 4 glucose or limit dextrin. So there will be negative glucagon challenge test. The blood sugar will not rise in spite even after giving the injection of the glucagon, correct? So negative glucagon challenge test. Now the next is, if you call the patient in fat state, suppose you call the patient ki come after taking a good meal, right? So patient went and had some good sandwich, right, and came back after 2 hours, right? Let's say after 1 hour you gave the injection of glucagon. Okay, so guys, within the 1 or 2 hours, what happens after consuming the food? The glycogen in the liver is completely formed. Not just 4 was already present, 4 glucose. The rest of the glucose residues are also made, the chains were made, right? So now you give the glucagon injection and the patient blood sugar will rise because glycogen was present in completely formed manner, right? So positive glucagon challenge test. So guys, how can you identify Cori's disease? You can identify the Cori's disease by looking at glucagon challenge test, negative in fasting, positive in fat state, and also by looking at limit dextrin type of glycogen present in the liver. These 2 things, correct guys? Now our next disease, that is Anderson's disease, that is type 4 GSD. Glycogen Storage Disease, is GSD. So type 4 GSD, Anderson, the name of the enzyme deficient is branching enzyme. So guys, the branching enzyme is missing here. ABCD, remember like this way, Anderson branching, Cori's debranching, right? So guys, if the branching enzyme is missing, what will happen to the glycogen? So whatever the glycogen stored in this patient will have less branches. See, in the Cori's it was small branches, but they were placed at right position. But now we have less branches. See, I told you that glycogen has branching after every 10 to 13 glucose. But let's say in this case, the glycogen has a branching after every 30 to 40 glucose, right? Just like the glycogen, there is a structure which is called as amylopectin, like in vegetables or in the grains, there is something called as amylopectin. So guys, because there are less branches which are present at very far ends, right, about 30 to 40 is the distance between the two branch, right? We can call this glycogen as amylopectin and the disease as amylopactinosis. Okay, right guys? Guys, see, when potato is like amylopectin, right? If you just mash the potato in water, it is never soluble, na? Right? So amylopectin is a structure which is insoluble in water because the branching is less. I told you, right, in the previous lecture that glycogen is soluble because of branching, more branching. So if it is less branch, less soluble. So guys, when it is less soluble, we call it amylopectin, or amylopactinosis is the name of disease. So because of less solubility, guys, this glycogen precipitates, right? So because of precipitation of glycogen, what happens? There is damage to the liver cells, and this may lead to liver failure and death of this child. So guys, Anderson's disease may present with liver failure at a very early stage. So guys, that is type 4 Anderson's disease, right? Then guys, we have type 5. Type 5 is called as McArdle's disease. Guys, McArdle's disease is a disease which is due to deficient enzyme muscle phosphorylase, right? Now guys, this patient is unable to use the muscle glycogen as a source of energy because phosphorylase is a rate limiting enzyme for breaking glycogen to use as a source of energy in glycolysis. So now when this patient do the exercise, they are unable to do any exercise. So muscle weakness or exercise intolerance is a term that you have to look for McArdle's disease. Okay, so McArdle's patient have M for McArdle's, M for muscle phosphorylase, and M for the muscle weakness or intolerance to exercise, right? So guys, because they are unable to break the glycogen, they are unable to perform any exercise. So that is called as McArdle's disease, right? But guys, if you train these patients, right, for exercises, then there is a term that is called as second wind phenomena. So second wind phenomena may be present in these patients. So what is second wind phenomena? The guys, that second wind phenomena is nothing like when we exercise, even a normal person, when we exercise, after few minutes of exercise, what happens is there is a metabolic shift occurs. So instead of muscle glycogen, we will be able to use the food from the blood, that is fatty acids I can use glucose from the blood as a source of energy, right? So these patients are able to use the second source of energy just like a normal person if they are trained to do so, right? That is training of the muscles. So second wind phenomena in the McArdle's disease is present. So what is second wind phenomena? The patient is able to use the extra muscular fuels as a source of energy, right, if they are trained to do so because of a metabolic shift this occurs, right? Now what happens next? That is type 5 disease, right? Then we have the type 6 disease, that is called as HER, Her's disease. Guys, hepatic phosphorylase is the name of enzyme which is missing here. But these patients have very less symptoms because the number of enzyme which are deficient is less. Okay, so these patients are rarely identified and hypoglycemia is not that intense. Otherwise, it would have resulted in the severe hypoglycemia if there is liver glycogen is not broken, right? So but these patients, the expression of this disease is very less, right? Means the number of enzymes which are deficient is less. We can say like that. So Hirsch's disease. And guys, the last is Tarui disease. So type 7 is Tarui disease, and guys, Tarui disease is because of the muscle and RBC PFK1 deficiency, phosphofructokinase 1 deficiency. Guys, these patients are generally young or childs. They also present with exercise intolerance. You know why? Because to generate energy in the muscles, we need the enzymes of glycolysis, which is absent here. So they are similar to the McArdles, but there are some differences that, you know, in this patients are mostly younger ones or the babies, right? And the second thing is because RBC PFK1 is also missing, these patients present with hemolysis. So hemolysis is the only key point that can differentiate McArdles and the Tarui disease apart from the name of enzyme deficient. Okay. So because RBCs are unable to perform proper glycolysis, there may be hemolysis also present in these patients. Right, guys? So that is our type 7 disease or the Tarui disease. Guys, the patients of Tarui disease cannot perform the second wind phenomena. They cannot be trained for exercise, right? Why they cannot use the extramuscular fuel? Because guys, to use the extramuscular fuel like glucose also, there is PFK1 is required. So that is not available. Right, guys? So thank you so much. This is our lecture on glycogen storage disease. Keep revising. See you in the next video.